on health product supply chain management. This is an issue that lies at the heart, at the center of a resilient and functional health system. And the theme, harmonizing health products financing and supply management systems, is both timely and vital. It calls on us to strengthen supply chains, optimize resources, and safeguard the sustainability of health product availability across the country. I'm very much delighted with the diversity in the room. If it was an animal kingdom, everyone. Because we know that the theme we're gathered around today is key for all of us to survival. But in the hospital, this is the biggest cry that we always face as administrators. And in the old times, it used to be common, once you have a health worker in the family, you are as good as having a pharmacy in your... But what does it reflect on health supply chain and logistics? It meant there was a lot of pilferage. And unfortunately, where we are now, such factors might have contributed to that. And we want, through this dialogue, to be very open and candid and explore all the areas that are making our situation not so desirable. So the objectives of this dialogue are very clear. We want to review the current state of Zimbabwe's supply chain system, highlighting best practices, highlighting the gaps, and look at the opportunities. 2, we want to examine the financing landscape for health products, focusing on efficient resource mobilization, allocation, and utilization. We know most of these products are actually imported. So without a robust financing mechanism, it can all lead to just a discussion, talking and talking. So we need a proper financing mechanism so that these resources are valuable. So examining the financing landscape becomes very important. 3, we want to draw lessons from real facility level experiences, and I'm so glad that when people were doing their introductions, I could tell that almost every facility is represented, various levels, from pharmacists, from the lab, from the procurement guys, our chiefs in the various institutions. They are here, and they're going to give us a facility level experience. And this will reflect on operational realities on the ground. So because there are always some fora where the real people on the shop floor are not there, and we present things that can then be totally challenged later. So today we will challenge each other. 4, we need to explore innovative strategies and governance mechanisms that reinforce both the financing and supply chain systems. 5, we need to agree on a collective way forward that deepens collaboration between government, development partners, private sector, and all players that will make our supply chain system robust. So a robust supply chain system is essential for effective health service delivery. And NATFAM, as the central agency for health commodity supply, plays a pivotal role in ensuring that our hospitals, clinics, and health facilities are stocked with medicines and supplies needed to save lives. So challenges that then affect NATFAM, whether in procurement, distribution, or inventory management, have a direct impact on patients, staff, and the overall performance of our health system. So we cannot shy away, colleagues, in making sure that NATFAM is accountable to us and we are accountable also to NATFAM. Because vanotitaurira kuti taendesa madrugs isusu to asi the public saying hakuna madrugs. So we need to be very open with each other. But for NATFAM to remain viable, it is essential that we operate under a correct and appropriate financing model, and the key of which should be a model that allows for funds to revolve. A revolving fund ensures that purchased commodities are replenished in a timely manner, guaranteeing sustainability, minimizing stockouts, and protecting, and this is very key, public resources, because these are public resources. So without such a model, disruptions in NATFAM's operations ripple across the entire health system, affecting service delivery and patient outcomes. So I will consider these as challenges that I want to pose to you. Number one, how are our facilities leveraging digital technology to track inventory, reduce stock losses, and improve procurement efficiency? Two, what measures are we putting in place, or that we have in place, to reduce wastage, pilferage, and expiration of essential medicines and commodities? There's nothing as painful as signing disposal of commodities that you know are needed, but they've expired. Honestly, with the shortages we have, ideally we should not have any expired, but we do have expires. So what are we doing to make sure that we reduce expiry of essential medicines and commodities? Three, especially to accounting officers, how can your accounting units ensure that allocated funds are utilized transparently and that resources revolve efficiently to sustain supply chains? As long as at some point in the supply chain there is a gap, or there are breaks, or money doesn't keep revolving, I can assure you we can continue capitalizing, and we are still at the same position we are right now. Four, it is very important that we innovate. We know we are in a resource-constrained environment. There's no doubt about that. We have also been decades of sanctions. We can only survive by innovation. So what is it that we are going to innovate around, especially these supply chain systems? And what can then be shared from your facilities or provinces to improve overall supply chain performance? Lastly, how are we collaborating? Not only amongst the institutions, but with NATFAM, with development partners. We have already collaborated in having this meeting going on here. Thank you very much to Chai, Crown Agents and others. But how are we collaborating so that we ensure uninterrupted health service delivery? So these questions are intended to prompt reflection, accountability, and action. And I hope by the end of this, would have answered most of these key questions. So access to quality health products is central to health equity and patient safety. So this dialogue, please, let not it be just another meeting where we sign attendance, we have drinks, we eat, and some we have not seen the PS or the CDs or the CMOs who say,